What if your medicine could talk? What if your pill could tell your doctor you swallowed it and even report when something went wrong? Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Delito, a family physician with interest on cancer prevention and treatment and public health. In this video, we are going to talk about smart pills. Yes, smart pills. So, what is a smart pill? A smart pill is a pill that swallow and it has medicine, it has a tiny sensor, it has a transmitter, it has a patch, and also a phone link. So what would make you swallow a smart pill? Various challenges force people to go to this extra effort. One of the challenges that the medical fraternity community faces is drug non-compliance. And the non-compliance of drugs happens at two levels. One, there is a failure to fill up the prescription. So when this happens is that the patient does not fill up his prescriptions. He doesn't take his medicines at all. So once the consultation is over, the patient for various reasons does not take the pills. This could be due to financial reasons, or even due to personal reasons, or even some psychological reasons. Then the other level of non-compliance is when the patient does not take the pills. The patient has the medicines, but for one reason or the other, he does not swallow them. There are several reasons that can make this to happen. Either the patient forgets intentionally or unintentionally. Sometimes the patient can just decide, yes, I have the pills, but I'm not going to take them. And so that is why people have devised smart pills, because non-compliance to medications has a lot of cost in terms of time. The patient's going to see the doctor, but he doesn't get the benefits of the treatment. The burden of buying the medicines and then not taking them. And of course, also you pay with your health because the medicines will cost you, and then your condition gets to worsen. So how does smart pills work? One, when the pill enters your stomach, the stomach acid completes the sensor circuit. And once the sensor circuit is completed, then there's a signal that is sent to the patch that you put on your body. Sometimes you may put it on your arm or your abdomen. And this patch receives the signal. And once the signal is received in the patch, then it sends a sign or a signal to your phone or even to some electronic gadget at some place. And this can also be a computer or an app that is with your doctor. And then your app logs it, and then your doctor can be able to see it. And this happens within minutes that you take the pill. So what is the evidence of taking these smart pills? So the smart pills increase medication adherence. As I've said, adherence is one of the major challenges in the healthcare system. And so when you do use the smart pills, the compliance and the adherence rate changes from 90%, from 60% to 90%. Then the smart pill also helps to detect dose timing errors. If you take your medicine between various timing times, then your doctor is able to notice this and he can advise appropriately. Then also the smart pills also remove the dangerous missed doses, especially for drugs that are life-saving. When you miss out the doses, then this can be life-threatening, and your smart pill can tell when you have taken your pill, and your doctor and your healthcare provider will be able to know that you have not taken the pill, and they take the necessary precautions. Then the pill can also be monitored on what is happening with your body, and so the doctor can be able to adjust the dosage of your drugs depending on the signals that is getting. And then the patients also understand the treatment better, because they can be able to monitor themselves, and they can be able to tell what is the effect of the drugs on their body. And the trials have shown that early success in mental health, in heart disease, in tuberculosis, and even cancer care when you use the smart pills. So what are the benefits that you get for using these smart pills? One, as I have said, it ensures adherence to the medications. It gives safety alerts. If there are any problems that are happening with your body, then your doctor is able to get notified on time. And also, these smart pills can also sense what changes are happening to your body when you take this pill, depending on how the sensor and the magnetic component of the pill is designed. Then you prevent overdose, because you know when you have taken the pill, your healthcare provider knows that you have taken the pill. And then you also improve chronic disease control. Some of the challenges that people have is when you have these chronic conditions, the lifestyle conditions, conditions like diabetes that require you to consistently take drugs. So the chances of missing out very high, because this is something becomes almost lifelong. Then there is less hospital visit because you're complying. Then the expected changes can be noticed, and if there is no improvement, then also your doctor will be on the rope. Then there are warning systems that inform your doctor of what is happening to you when you take the pill, and then there is real-time monitoring. And then this assures better outcomes, because your doctor can be able to see that you have taken the pill. He can see what is the impact of the pill on your health. So what are some of the limitations when we are talking about smart pills and the implications to public health? One, it is expensive. There are concerns about privacy, because of course any information about you that is shared to a second or third party, then there is concerns of privacy. There's need for smartphone for you to get the notifications. There's need for internet where there is no good internet development, then there is that challenge of connectivity. It is not meant for emergencies, because you cannot be able to give this drug for emergency situations. And then not all medicines can be suitable for this technology. So what is the future of these smart pills? Scientists predict that pills that track the stomach health will become the norm. Pills that release medicine slowly, depending on your needs. Pills that monitor your temperature and even your gut health. And also pills that will be used for cancer treatment. And some of the advances that are being experimented, especially in cancer treatment, is coming up with drugs that can be specifically targeted to the cancer cells that are multiplying abnormally, sparing the normal cells. And this would be a major breakthrough in cancer treatment. Then pills that can detect internal bleeding, like for example, people who are having gastrointestinal bleeding, you can have laser, what they call the nanopills, that can be directed to the bleeding place, and they can be able to seal the point of bleeding. This is a technology that is developing. Then there will be pills that can be able to monitor your gut microbiome, and there is a lot of interest in this gut microbiome when it comes to brain health, when it comes to inflammation, when it comes to cancers, and it is proving to be quite might be a big changer and a game changer in the future. And then you have pills that deliver the exact dose of the drug that is required. So medicine is becoming alive. You do not have to go by the theory of everything fits everybody the same way. So depending on your body size, depending on your illness, depending on your metabolism, you can have the drug adjusted to your body requirements so that you don't have one size fits all. Then smart pills are the next step in the digital health. And so if you want to learn more on what is happening in the field of drug development, then subscribe to learn more about the future of your health, because it is good to be informed. Thank you for watching.